I think the minute that you realize that you are different, whatever that might mean to you, it can cause you to feel incredibly isolated.
Body dysmorphic disorder is a disease, a mental health condition that usually occurs with OCD or OC spectrum disorders, where a person can find either an imagined or a very small flaw, and then they blow it up to be extremely large. With BDD, people see things in parts. They don't see the gestalt, which is the whole is greater than the sum of their parts. So they might see lips, teeth, a snaggletooth, a pimple on their face, hair where it shouldn't be. And they blow it up to be so big, and they imagine that there's a magnifying glass on them and everybody is viewing them through that distorted frame. My name is Dr. Lauren Stutman, and I am the owner and clinical director of Care LA, a clinic in West Los Angeles that specializes in treating anxiety, giftedness, perfectionism, OCD, and related disorders. So with BDD, one factor is not going to cause it. Bullying in and of itself will not cause it, but it can really exacerbate or bring it on. The same is true with parents. I know a lot of parents feel very guilty when they learn about BDD and the ways they might have contributed. But the truth is, the parent themselves did not cause the BDD. It's a holistic view, and it's not just you got bullied, or your parents said that, or you do have something going on with your face. It's really a culmination of all those factors. It's a biopsychosocial model. BDD is the antithesis of vanity, because whereas vanity, you might think somebody is full of themselves because they're so beautiful, somebody with BDD actually feels more that they're going to offend somebody with the way they look, the way they smell, the way they speak, the way they sound. And when you have that core belief, it becomes all-encompassing. And because of that, there's a feeling of helplessness.
You don't talk about how bad you feel about yourself. You never talk to anybody about just how different you feel from everybody else, or just how flawed you feel as a person. My name's Leigh de Vries, and I am an artist. My latest exhibition, called Screaming Inside, is all about my journey with body dysmorphic disorder. I was born with a hereditary disorder called third nerve palsy. I would want to call it a lazy muscle in my right eye. The muscle just doesn't work like your muscle should in your eye. So my eye sort of went all the way over to the side, and mine was completely blind. But I mean, a pendulum of what could be physically wrong with you, a wandering eye, is very minimal, but you can't really quantify someone's shame. I think that's where the shame really started for me. Just the fact that there is something really horribly wrong with me and that I should feel ashamed about it.
There's a difference between guilt and shame. Guilt is I did something wrong. Shame is I am wrong. So in a way, our perception box, which is based on our neurobiology, epigenetics, the messaging we're being told, will lead us to say things like, he's not looking at me because I'm hideous. And our worlds and our box becomes smaller and smaller. BDD is very similar to OCD in that you have this intrusive thought, my nose is big, my nose is big, my nose is big. And then you have compulsions or things you do to make the anxiety go down short term. So I might say, how does my nose look to you? You might say, it looks fine, you know, you're crazy, it looks fine. That might help me for a minute, but it's eventually a vicious cycle. We get so stuck inside our beliefs and our core beliefs, and our perception box becomes smaller. We can't really tell what's right or wrong, what's healthy or not, the way we're thinking, because we're just lost in it.
I started to create a space between myself and the world. I became very insular and was just trapped in this pain bubble. When I had my eye operation to straighten my eye, I was still dealing with all of the feelings and the emotions. because even though the eye was fixed, everything else was still there. When I decided that school was no longer the place for me, I just thought, well, if I put on this really brave personality and just storm out into the world, then maybe I don't have to deal with my shame, which is exactly what I did. I was in the midst of organizing photo shoots, organizing music videos. My whole life was about wearing this crazy mask that I could do anything and be anyone. The anxiety before the shoot was so debilitating that it was destroying me. It was exhausting. So the mask had to come off.
I hear so many of my patients saying, I don't know what I look like. I don't know what people see me as. And they often tend to say, I look different from day to day based on my mind state, based on the mirror I'm looking in. So it's this really scary world where you don't know that you can count on your internal representation of yourself.
I think I was reading up about something and I found body dysmorphic disorder. And suddenly everything sort of clicked for me of my separation anxiety, my wanting to withdraw, the thoughts and feelings that I had about myself that were so sort of inappropriate. I went through a phase where I didn't leave the house for 2 weeks. So I would just isolate more and more and more.
When we're working really hard on our thought patterns and our behaviors and possibly taking medication if indicated, our mind can shift from really negative perceptions to compassion. And the more I go there, the more my brain shapes to be able to feel that. So the more you go to a shame place, you're like working out that neural network. But when you start to question and shift to more positive things, psychedelics, meditation, breath work, things of that nature can open you up again and have you be able to reevaluate your core beliefs about yourself, the world, and your entire paradigm.
I didn't tell anyone what was happening to me because I was so hyper-independent. I needed something radical to be able to really expose what was going on internally. And that's kind of where the first project came from.
My thoughts of myself have always been distorted.
I didn't even realize that in psychiatry, they use this thing called exposure therapy or flooding, where they might expose yourself to the thing that bothers you the most so that you kind of get over it. I thought if I could physically create something on the exterior of myself, this prosthetic on the side of my face, I could sort of understand more about the physicality of what was going on in my brain.
Don't look at me.
So ERP is exposure and response prevention. We expose ourselves to the uncomfortable feelings, and then we prevent the typical response that we might do, such as putting on my glasses, covering our mouths, shying away. So we really stay in that really uncomfortable place. In order to have a good exposure, you need 3 main factors: intensity, frequency, and duration. However, there are people who are not ready to do that. So they would be able to work on things like cognitive distortions, black and white thinking, labeling, fortune telling. So they would restructure their thinking patterns. But there are other treatments as well. There's neurofeedback, narrative therapy can help, cognitive behavioral therapy, art therapy. And then finally, the ERP, when you're ready to do it, is something that helps through behavioral changes, through being able to do an experiment, going out looking what you deem ridiculous or hideous and seeing the reaction of people.
When we took the prosthetic off, it was really interesting because it was the first time that I actually realized that there was nothing wrong with me. Just like really understanding the fact not very many people notice you. I think the biggest takeaway is just allowing yourself the space to feel what you feel and not be ashamed by it and not try to run away from it. I've had such a cathartic experience from the radical exposure that I did in my first project to then continuing the work and continuing to try to understand myself, and instead of going into shame with how bad I feel about myself, instead I try to explore it. So the shame no longer becomes an enemy, it's very much a part of my artistic expression. And so within that, I found a space of compassion. And I think that it's the greatest gift that I've ever been given.
Gratitude decreases our inflammation response. Being in a state of gratitude is the opposite of fear. It's one of the most powerful things I teach my patients and that I practice myself when I'm upset. And I tune into that feeling, and it changes my brain chemistry. And the brain chemistry changes your thinking patterns. And by changing our behaviors and changing our thinking patterns, we see kids really changing the way that they view themselves, their parents, the way they interact interpersonally, and their sense of self.
I guess something that I'd love to share, if you allow yourself to go into the space that you're the most afraid of, there is so much value there. I think it's a friend of mine now, in a way.
The things that we suffer with, as long as we are able to grow past them, they become a way that we can connect with other people and touch their lives, and then they go off and touch other people's lives. So it's really important to be able to zoom out and realize what's important to me, what are my values? Because you can't heal from tearing yourself down. You can only heal from loving yourself and building yourself up.